I am joined by Congresswoman Marsha Blackburn of Tennessee, Republican of Tennessee, Senator Tom Coburn, Republican of Oklahoma, Senator Ben Nelson, Democrat of Nebraska, and Congresswoman Debbie Wasserman Schultz, Democrat of Florida. And Senator Nelson, let me begin with you on this overall question. You heard Senator McConnell, several other Republicans yesterday saying this is the vote. And a couple of weeks ago, you seemed to agree. You were talking to our John Carlin. You said if you couldn't live with the bill, then you wouldn't vote to let the debate begin. So does that mean that you can live with this bill?
No. What I meant by that is that if I thought the bill couldn't, this was before I saw the bill, but if I thought the bill couldn't be amended and couldn't be corrected and improved, then I wouldn't vote to move it forward and move the debate. But when I saw the bill, I said this can be amended, it can be improved, and the debate should begin, and we ought not to stop the opportunity to improve the bill when it can be.
But to be clear, if there were a vote to end the debate today, you would not vote to end the debate?
I would have voted no. I would have voted no. I would have voted to end, not to end debate. I would have voted no on a cloture vote to end debate.
So you wouldn't let it get off the floor?
So I would not let it get off the floor. That's what that means. That's the next round.
Senator Coburn, you also promised before the vote yesterday to read all 2,000 pages, yet you didn't do it. Is that a sign to you that just the handwriting's on the wall and you decided to fold?
Well, it didn't accomplish a purpose. What we're going to do is read the bill to the American public. I think what you'll be seeing when we come back is us going through it section by section, explaining what it means. It was a symbolic gesture, but it didn't work with what Senator Reid and Senator McConnell wanted to do. Understand that. I don't think we lose anything in the debate, but the important thing is for the American people to understand that this bill doesn't fix what's wrong with health care. We're treating symptoms, not the disease. And it's really malpractice what we're doing. The problem in America today with health care is it costs too much, George. And there's nothing to address that, and $1 out of every $3 that Americans spend today doesn't help anybody get well and doesn't keep anybody from getting sick. So why would we not want to go and fix the problems in health care, not the symptoms that all the politicians play around with, but the real problems?
I want to get to Congresswoman, but first let me just answer that one point. He says it doesn't do anything to control the cost.
Well, you know, it doesn't do enough to control the cost, that's for sure. And we do need to address that cost containment. I'm very concerned about that. But I certainly couldn't say it does nothing. I think the effort on prevention, early detection, wellness, the workforce development for more primary care physicians, those will all be helpful in reducing the cost of health care.
Ask the question, George, why do we have a imbalance in primary care physicians? Why is it there? Anybody know? It's because we pay them 300% lower than we pay the subspecialists. And so we don't do anything in that. We're going to help pay for some of their education, but we do nothing to change that balance. 1 in 50 doctors graduating last year decided to go into primary care. That's a disaster that has been caused by Medicare setting the prices.
So not enough for primary care, although as you point out, there are more incentives for primary care education in this. What I want to bring the question to you, Congresswoman, is the differences between the House and the Senate bill. Some fairly significant differences over how to pay for the bill, over how abortion services are covered on size, $1 trillion or so for the House bill, below 900 on the Senate bill, and of course on this public option. So when you look at what the Senate is considering now, is that something you and the majority of Democrats in the House can go for?
Well, what's important to focus on, George, is that there's far more that we have in common between the two bills than our differences. And while some of the differences are significant, all Democrats, whether it's a Senate Democrat or a House Democrat, are committed to health care reform and making sure that we can cover the people in America who are uninsured. About 31 or 36 million individuals are covered by both of these bills. Make sure we can provide security and stability to those who don't have health insurance, and that's been really under-examined. We have, you know, about 85% of the Americans who have coverage, and every year, whether you're a small business owner or an individual, they have skyrocketing insurance premiums that this bill will get a handle on both bills, and making sure that we can bring it down and control costs. And with all due respect, Senator Coburn, both of these bills will bring down costs and control costs and make sure that simply by getting rid of insurance companies' ability to prohibit, to drop you or deny you coverage based on a pre-existing condition, creating insurance exchanges so that we can pool individuals and broaden the number of people that are covered and bring down the cost of their insurance, making sure that folks have the ability to have their premiums set not based on gender, which causes women to have a 48% on average higher premium, but making sure that we have just a few items that are rated by insurance companies to bring down their costs.
You hear that case, yet not a single Republican in the House voted yes.
And with good reason.
Actually, I take that back. Congressman Gow from Louisiana, I forgot him for a second. One Republican.
And with good reason for not voting for it. We had a Republican alternative that actually would have brought down the cost of health insurance. CBO scored both plans. They said that our Republican alternative would have brought insurance costs per family $5,000 per year less. Would have brought those costs down, and that is $5,000 less than the least expensive Democrat proposal. Now, we all
Georgia,
agree there need to
covered
be
5 million
reforms. We all agree there need to be reforms in health care, but we know that putting this government-run health care that leads to a government takeover, it doesn't work. There is no test case out there that they can point to, no pilot project they can point to where a government-controlled healthcare system has brought down the cost, increased the access, taken care of those with pre-existing and chronic conditions, allowed portability, dealt with malpractice reform. Those are things we as Republicans are for, and unfortunately their bill does not achieve what they are saying they want to achieve.
George,
look at what has happened when you look at the cost of Medicare. It has skyrocketed. What is it, 700%?
Let's get an answer and then we'll move on.
It's important to know that what CBO also said, that their bill would only cover about 5 million people, not even coming close to addressing the problem of the uninsured or the underinsured. It doesn't address requiring insurance companies, prohibiting insurance companies from dropping you or denying you coverage for a pre-existing condition. It allows for association health plans.
But what we
Excuse me, Marsha. It allows for association health plans, which means that all the mandates, like for mammograms, and making sure that women and people who need coverage in this country, all the mandates would be gone and you'd go to the lowest common denominator. This is a bill that doesn't even come close to addressing...
Incorrect,
no, it is not
what
incorrect.
It does
it's a bill that doesn't even come close to addressing...
and reinsurance
it's a bill that doesn't even come close to addressing...
I want to go back to Senator Nelson here because we heard about some of the differences with the House bill, and I want to press a little bit more on what your bottom lines are going forward. We heard your colleague, Senator Lincoln, say if the public health insurance option is included in the legislation, she will not vote to get it off the floor. Do you agree with that?
It depends on what the public option is. I'm opposed to the public option of where the states have to opt out. I said I would look at a public option where states could opt in, but that if they opted in, it wouldn't apply to every other state. I really think that you can have state-based solutions in many instances where the states can step forward and take care of certain responsibilities with some assistance from the federal government.
The second big issue, abortion funding. The Senate bill allows more public funding of abortions than the House bill, than the restrictions under the House bill. If that language remains, can you vote to get this off the floor?
No. But I might not vote to get it off the floor because of other considerations as well. Even if that was perfected, where I could support that particular provision, if the public option is wrong, if the Class Act is still in it, if there are a whole host of other items that are the same as they are right now, I wouldn't vote to get it off the floor.
These are significant differences with what the majority of Democrats in the House have called for. Do you believe your colleagues will go along? I know you say there are basic areas of agreement, but if on these key issues Senator Nelson and his centrist colleagues win out, will this bill get through the House?
But what Senator, I want to speak for him, but what Senator Nelson you don't hear him saying is that there isn't any room for negotiation or compromise.
On public option, he said.
Well,
no. I mean, we could negotiate a public option of some sort that I might look at, but I don't want a big government Washington-run operation that would undermine the insurance private insurance that 200 million Americans now have.
So Democrats are prepared to compromise again on the public option.
We're going to sit down in the conference committee and make sure that we can hammer out the differences between the two Senate bills, which we have done in America since the Founding Fathers wrote the Constitution.
They are confident they're going to get a bill.
I'd make 3 points. One, 61% of health care in this country is already run by the government. Name one that works well. That's the number one.
Well, I think some would argue Medicare.
No, it's highly efficient and it's going to be broke in 3 years. How can you say it's running well? Let me finish my point. Let me finish my point. Number two is this bill creates 70 new government agencies with thousands of new bureaucrats with 1,500, I'm talking about the Senate bill, with 1,597 different instances where the Secretary is mandated to write rules and regulations. If you think that isn't going to get between patients and their doctors, I have a whole lot of swampland in Oklahoma I'd like to sell you. The third point that I would say is we can fix all these problems, but we have a government-centered approach that is already failing instead of a patient-centered approach. And we ought to be concerned about patients, not the government. And there's 11 studies out as of this morning that said both the House bill and the Senate bill will raise premiums, not lower them. That includes the Joint Tax Committee and the Congressional Budget Office, as well as 9 other independent analyses. So do we all want to solve health care? Yeah. Let's fix the real problem. Let's